Hi, my name is Lily. I am a fourth year student dermal clinician, and as a part of my independent research project, I am investigating UV exposure in rowers. For today's talk, we're discussing skin cancer and skin checks. UV radiation is a carcinogen for humans, causing basal cell carcinomas and squamous cell carcinomas. These often appear in sun-exposed areas of skin, and when discovered and treated early, they are usually curable. Sunburns from excessive UV exposure have a strong correlation in the development of melanoma. UV radiation that damages the skin can also alter the gene that suppresses tumors, therefore increasing the likelihood of sun-damaged skin cells turning into skin cancer. Melanomas are the most aggressive form of skin cancer, with Australia having the highest rates of diagnosis in the world, and it being the third most common cancer that is diagnosed. The risk of melanoma diagnosis in your lifetime is 1 in 13 for men and 1 in 21 for women in Australia and New Zealand. There have been many skin cancer campaigns to encourage the general public to look after their skin and help reduce the burden on the healthcare system by decreasing the prevalence of skin cancers. Some of these campaigns include slip, slop, slap, seek, and slide, slip on a shirt, slop on SPF, slap on a hat, seek shade, slide on sunnies. This is a campaign that most people who grew up in Australia are familiar with, as it was a popular jingle that was implemented by the Cancer Council. The SunSmart app uses is available on most smartphones and gives the user a real-time reading of the UV index in their location. There was also no hat, no play. This was a rule enforced by most primary and secondary schools, dictating that students weren't allowed to play outside without a hat. Getting a skin check performed regularly is essential for early detection. This can be done through a dermatologist or a skin cancer clinic. It is also essential that the person you are seeing is certified in dermoscopy. To get someone you know to trust and look over your skin and look for lesions that look abnormal or are new. You are able to monitor your own skin between checks also, making sure that you are looking out for the A, B, C, D, E's of skin checks. A is for asymmetry. If there was a line down the middle, would it be even? New moles and freckles are typically symmetrical. B is for border. Lesions with a blurry or spiky edge might be a sign. C is for color. Moles or freckles that have more than one color should be monitored. D is for diameter. If it is larger than 6 millimeters, it should be checked out. And E is for elevation. A lesion that is raised or has an irregular or uneven surface could be a red flag. What to look out for when you need to look out for scaly red lesions that might crust or bleed. Raised growths, sometimes these have a sunken center also. Open sores that don't heal or they heal and come back. These may ooze or crust. Over the age of 30, you shouldn't be getting any new moles or pigmented lesions. Keep an eye out for these. Thank you.